I came here to have my tricuspid valve replacement that I had 20 years ago. It was damaged from a fall, we believe.
Go ahead and change out her heparin bag. My name is Daniel Steck. I'm a registered nurse here at Houston Methodist, Walter Tower 20. Today I'm taking care of Miss Gersi. Well, she prefers to be called Yolanda. She's been here for a while. She was in the ICU after she had her tricuspid valve replaced. This was her second time having one done. So it was kind of a rough course. But today she's doing well. We've already walked in the hallway twice with cardiac rehab. So our main goals with her right now is to get some more fluid off of her. She's still volume overloaded.
I've had a lot of issues while I've been here. I've been hallucinating. I was about to give up because I could not breathe at all. I mean, it was very hard for me to do so. When I went to see Dr. Rule, we saw other things going on. One of them was that the pacemaker wires were kind of scattered around. The other thing was that I have AFib, and the pacemaker had flutter. Also, my lungs, I was starting to retain fluid, so I had to have that drained. Then Dr. Naziri did the cardioversion. After he did that, a couple days later, I go to ER because I couldn't breathe. So it was that I had fluid around the heart.
She's had quite a few setbacks. So she also, I believe, had a TAVR done. But with her, some of her issues are that she's having recurrent pleural effusions. So with pleural effusions, you typically have water that builds up in your lungs, and there are certain medications that we give them, like Lasix. So sometimes with getting Lasix 3 times a day, it can make you very tired. So that's something that she's experiencing today. Just a lot of fatigue, not really wanting to walk. My name is Alexis Jones. I work at Houston Methodist Hospital, and I've been here for a little over 2 years. I currently work on Walter Tower 20, which is a cardiovascular unit. A couple years ago, my grandmother was diagnosed with stage 4 pancreatic cancer, and then I met this nurse named Jenny, and she was actually the hospice nurse that took care of my grandmother. And what I loved about Jenny was how compassionate she was, her personality. She made a really big impact in my life, just really showing me the ropes.
Take a deep breath. Have you been using your spirometer?
I tried using that. I'm not getting real strong on that. I don't know why. Okay. But
So what I want you to do today is every time there's a commercial break, I want you to do 2 breaths.
The benefit of our team is that there's lots of people to reach out to. So when Dr. Rule's not available, there's always his nurse to call. There's always a surgical resident to call. There's also his partners to call too. So all the surgeons in this group are all a team. So if there's ever a question that's regarding an urgent matter, or if a patient's vital signs aren't doing so great, everybody's always willing to help each other out so that we can make sure the patient's okay. I'm just gonna look and see if there's another thing I'm missing when it comes to getting you better. My name is Caitlin Peters. I'm a physician assistant in cardiovascular surgery. I've been at Houston Methodist for a little over a year. I take care of patients before, during, and after surgery. A major part of my role includes education, so I typically have many answers to those surgical questions that a patient might have regarding what the surgery is going to be, what they can expect, how long their hospitalization is going to be. I know that it can be frustrating just because it feels like a lot of things are out of your control after surgery.
I mean, I knew that when he mentioned everything that was going on, but not the stuff that he saw when he went in there, extra. So Dr. Rule mentioned that I had an enlarged heart also. Of course, when he went into surgery, he sees a blood clot here. He took care of that. And during surgery, he thinks that a clot dripped kind of down to here. So I'm still going to be on blood thinners for a while. I just seem to have a lot of complications. But I am feeling better. And Dr. Rule was magnificent. He's super, super cool man. Dr. George Rules grandson is also practicing. So that means, he says, maybe in 20 years. My son, I said, I don't think that's going to happen. You know, I'm going to be like into my 90s. I'm not even going to worry about it. While Dr. Wu was in there, though, with the enlarged heart, he also made it smaller.
When you come in and you have heart surgery, or you're told that you're going to have a heart surgery, it's very stressful, it's very scary type of procedures. We've come to now cutting edge. We're in a whole nother level with heart surgeries, where back when I had heart surgery, it was a completely different surgical procedure. I think it gives me the ability to connect with the patients in a different way. So not only can I say as a nursing professional that I have taken care of patients for 23 years now, I can also say, you know, we've come such a long way that you're gonna do well. My name's Leanne Hartman. I am the nursing director for the CV acute units on Walter Tower 19 and 20 here at Houston Methodist Hospital.
All right, so for Miss Maria, so like I said earlier, she is having a little bit of a setback today, but I expect her to be here probably about 3 more days. We're gonna take care of the fluid in her lungs and hopefully get her out of here by the weekend.